Thank you so much for having me today. I'm really excited to be here and get to talk about cluttering. So I'm a speech language pathologist, and I've been working for about 10 years. And I'm also a new business owner. So I started my practice, Infinite Horizon Speech and Language Services, last April. So in my practice, I focus on treating clients who stutter, doing evaluations and treatment. And also, I would like to provide continuing education for speech pathologists. So I've started doing some presentations as well. And also wanted to just put in, as I'm describing everything for the video today, everything's just for educational purposes for all the viewers. So though I'm a speech pathologist by profession, I'm not like doing that, individually right now. So always be sure to consult somebody in your local area for, things that are tailored to your specific needs. If there's anybody out there watching and learning from this, I hope you find it helpful. And full disclaimers on my website at www.infinitehorizonspeech.com/disclaimers. And the reason I'm so interested in doing that is because in school, we don't get as much training in stuttering as some other disorders. And when working with people who stutter, there tends to be more of a counseling aspect, which is also something that we don't get too much training in either. It's kind of talked about in classes, but we're not like actual counselors who have like full classes on counseling techniques. So the combination of those two things means that a lot of speech pathologists come out of school feeling kind of like not super comfortable treating stuttering. And so what I would like to do is provide courses in an accessible way, like, online or ways that are easy for people to access, and then they can learn and improve their knowledge and feel more confident for people who stutter and clutter who come in their clinic. Yeah, that's a good question. I guess when we think about we call it the big nine, is well, at least it used to be called the big nine, the different conditions that we learn how to diagnose and treat in speech pathology. There's lots of people that we see with language disorders, lots of people we see with articulation disorders. So that tends to form like the bulk of our caseload, at least in certain settings. And so while we do sometimes see people who stutter, it just is a much smaller percentage than those things. And so I think that's where it gets weighted a little bit more into those areas, and probably why it's just less coursework in that area. Oh yeah, no, that's a good question. The American Board of Fluency and Fluency Disorders has a number of the actual board certified specialists. I don't know exactly what that is. Maybe is it like in the between 100 and 200, probably closer to 100. But there also are a lot of SLPs who are not board certified, who are very interested in stuttering and provide excellent treatment as well. But if I had to give like a number of like technically like specialists who have like a designation for it, it'd be that number. In graduate school, we had something called Diagnostic Teams. And what that is where you're working with a partner and you are doing assessments and evaluations together. And you're actually working with the supervisor to learn how to diagnose all the different types of speech and language disorders. So I did one specifically about stuttering. And so I learned about that and trying to differentiate stuttering from cluttering. And we had this like go-to book called Assessment in Speech Pathology with a chapter on stuttering and cluttering, and has a really handy table that like I still pull that thing out like all the time. So I remember, reading about it there. And then also who I was working with, she had previously had a client who cluttered in the clinic as well. So she would tell me about her experiences working with that client. So that was really my first experience, really learning about cluttering and how to differentiate it from stuttering in treatment and therapy. Between cluttering and stuttering, I guess cluttering is more about excessive rate and irregular speech rhythm, articulation errors, possibly disorganized language. Those are more things that we would look at for cluttering. Whereas with stuttering, we would look more at, are there blocks, repetitions, prolongations, and sometimes there might be something we call physical concomitants. So that means moments of struggle when person is stuttering, like eye blinks or like facial grimacing or like tapping their hands or feet or something like that to try to get the words out. You said, how is cluttering different from stuttering? Like when we see somebody speaking, it seems like it's more just like speaking fast, or like speaking in little bursts where it's speaking and then it's a burst of fast speech, and almost like all of the information is presented in a big chunk where it may be hard for the listener to follow because there's not much pacing or pausing in between the information. Whereas with stuttering, it's not so much about fast speech or having difficulty like actually understanding what the person's saying. It's more about like a loss of control over speaking, and the person feels like they know what word they want to say, but for some reason, you know, it's going to come out repeated, or it's going to come out blocked. And sometimes somebody will develop ways to try to avoid those things from happening, and that's a whole other discussion. But in cluttering, we don't really see those avoidances as much, and we don't really, it's not the same type of loss of control over their speech. I think so. What I've heard is that people will say that they're not understood, or they might say like, "Oh, I'm having trouble understanding you," or sometimes in like school or work situations, the person might just get general feedback like, "Oh, you kind of need to improve your communication skills," and maybe their impression is like, you know, they're not communicating themselves clearly, like not communicating their ideas clearly or enunciating clearly, and so they just have some difficulty understanding everything. Sure. So I really think one of the most foundational things is just really helping people understand what cluttering is. So, like I was just saying, a lot of people just in the general public don't actually know about cluttering. With stuttering, even lay people will recognize it for the most part and kind of have some kind of concept of what it is. But I don't really feel like just the general public knows about cluttering. And so you know, people may get that general feedback of like, oh, can you say it more clearly, or just general statements about, you know, can you improve your communication skills? And so that can be kind of frustrating for a couple of reasons. So one reason that can be frustrating is people who clutter don't always perceive that they're having difficulty being understood. And then also sometimes people genuinely are trying to improve their speech and communication, and then the person still tells them that, and it's like, wait, what? I'm trying here. And so you know, I think helping them understand like this is an actual condition, and like there's, you know, reasons for this happening, there's treatment for it, you know, if you do the correct treatment, there's help you can improve. And like that just gives like a big relief to the client. You know, it's not like just hearing those things all their life about, can you speak more clearly, can you speak more clearly, like just like there's something here and we can help. Yeah, I think that having an understanding from those around them is really important, because if their parents, teachers, or whoever, you know, may feel like that this is something that's easy for the person to control, like say for example a child, if we're talking about that, they may feel like, oh, they're just not putting in the effort, or you know, just not really understanding like why are they not speaking clearly, and thinking that it shouldn't be that hard, then it may be frustrating for everybody involved. It's frustrating for the child, it's frustrating for the parents. But if everybody's educated about cluttering and really knows what it is, and then knows like the most ways that they can support the child of maybe reinforcing like whatever techniques are appropriate for their type of symptoms, or just having that understanding that this really is a challenge for the child, and maybe doing some exercises that help strengthen the skills that are weaker, you know, that kind of changes the whole dynamic, and there's not that feeling of frustration and all of that. Yeah, I don't feel like I've had as many like children who clutter come into the clinic. So anytime like I've kind of suspected cluttering, for the most part, I've ruled it out. So I actually feel like more adults, you know, realize like they're getting that feedback from work. Like I'm not communicating clearly. My boss is telling me I need to work on it. So I call a speech pathologist, you know, like that type of thing. But I certainly feel that parents could react that way and just feel kind of baffled as to like, you know, we remind them all the time to speak clearly, and like it's still not happening. What do we do? Yeah, the most difficult part is just identifying cluttering. So because some of the symptoms are more general, like just indistinct speech, or maybe just not expressing themselves clearly, it's also very similar to articulation disorders or language disorders. And so you really have to understand what cluttering is and be able to identify, okay, how is this different from an articulation disorder? You know, is it a language disorder? And another reason it's difficult is because when people who clutter are in situations that heighten their awareness of their speech, then they tend to focus on it more and it actually gets better. So if you could think what situation would make you focus on your speech more than like a speech evaluation, you know, like the person's probably, you know, going to be really focused on their speech and they might not be speaking in the same way that, you know, just relax talking with your family at home or you're at a party with your friends and telling a story, like you're like, okay, I gotta put on a good impression here. And so anyway, so you might not actually see all the cluttering symptoms because they don't arise in every setting. So you have to be very observant as to, okay, what am I actually seeing? And then also listen to the client's description of what's going on and what kind of symptoms they're experiencing. So you can say, okay, I'm hearing some descriptions that sound like cluttering. And then also, it may take a few sessions to actually get a definitive diagnosis because sometimes it just takes a little time to gather enough data to be sure that you can say it's cluttering. I think the easiest part is just explaining about cluttering. So I'm a huge speech and language nerd. I love learning about it. And so anytime I get to like talk about it, I get excited. So if I can talk about speech and language with my client and teach them, you know, just like, okay, this is what speech is, this is what language is, this is what cluttering is. And, you know, then also it's really rewarding to see their understanding and relief, like, oh, this is like an actual condition. Like, you know, there's a reason why this has been happening to me and there's things I can do to make it better. Like, that's really cool too. Yeah. Just like, oh, okay, this, or like kind of the light bulbs going off, like insight, like, wow, oh yeah, that's exactly what's going on. And you're just like reading off this whole list of characteristics and it's like, oh yeah, this one, like this one, this one, this one. And just realizing like, oh yeah, like other people out there have this. And yeah, a lot of insight. Well, I'd like to first start by sharing a couple books that have been like super helpful for me. So this one right here, Managing Cluttering. You see, I use it as all my tabs by Kathleen Scaler Scott and David Ward is super helpful. So they give background information about cluttering and then tons of explanations for clients and parents. This is for children all the way through adults and lots of actual like workbook activities. So it's super handy. As far as techniques, some things that I do are helping the clients identify moments of cluttering and improve their self-awareness. Not all people who clutter are able to perceive when they're talking too fast or when their articulation breaks down. So helping them learn about that. Then we'll also learn about different speech rates and how you can adjust speech rates. So that's actually where the computer program I was mentioning comes in handy. So what you can do is record into the client's speech into a program called Pratt, and then it converts the sound into a graph called a spectrogram. And you can see when the client's speaking and not speaking. And okay, are there any pauses when they're telling a story? Or is it like just all a big chunk of information? And then you also can use it to calculate speech rates using like there's little speech calculators that you can download as apps. And us speech pathologists, we get pretty good at like calculating little rates. I'm just going there with my little calculator and getting it. So that's pretty cool. We can use that program and then you can actually get really measurable data about how long the client's pauses are and how often they pause. And then, okay, instead of just saying like, oh, I think you were a little bit slower, you know, in this sample than the last sample, it's like, oh, this one was 3.8 syllables per second versus 4.2 or something. And it really helps show what they're actually doing. And then you can actually hear it. It's like, oh yeah, like I can hear the difference, or you calculate it and it's kind of subtle, but you can start measuring that subtle progress. So something else we can do is stuttering modification, like cancellations. So a cancellation is when a person notices that they clutter and then they kind of pause and then restate what wasn't said clearly in a more clear manner. And so this is kind of an empowering thing. So it's like, it's showing that the person recognizes there is a communication breakdown. And then it also gives them a chance to practice saying it more clearly. And then also it serves as a little reset. So if the person has been kind of increasing their speed more and more, and then they realize, oh, wow, I just kind of collapsed that word and it sounded mumbled, then pause, and then it's like allows to reset and start on a better speech rate that's a slower rate. So that's helpful. And then another technique is learning about which aspects of cluttering are more speech related and which ones are more language related. So some aspects of cluttering are more about like the articulation, like leaving out syllables or omitting sounds in words, and they kind of get collapsed. Like longer words like television or grasshopper or helicopter, they get kind of mushed together. So that's more like how your physical speech is coming out. Whereas when we're talking about language, that's more like ideas and how you're expressing yourself. Like, are you including enough background information? Is there, like, are you putting a clear order to the information you're trying to explain? And are you giving enough information at that time? Like, if you give too much information, the person's going to get lost. If you don't give enough, they're also going to get lost. So, you know, sometimes people who clutter do one of those things, probably more like giving too much information and not, the person has trouble following them. So learning about, you know, what are those different things, and then we'll go through techniques for, okay, how do you articulate these long words? Or, okay, we have some exercises to learn how to be more clear and concise when you're explaining things. So that's that one. And then I'm trying to think, a few other things are just working on language organization overall. And then another thing is learning how to self-monitor for communication breakdowns. So instead of not realizing when somebody doesn't understand, we teach the person, okay, learn how to recognize certain facial expressions when a person doesn't understand you, and then be able to repair those breakdowns. And then at the end, kind of when people are getting close to the end of therapy, we want them to be able to like really just self-monitor their speech and language overall and be able to problem solve those situations independently. So in general, I'd say just learning like how to be kind to yourself and learning that everybody has different challenges in their life. So, you know, speech may be your particular challenge, but just keeping in mind that everybody has something can be helpful, and learning how to be more kind to yourself can help you be more kind to others whenever you encounter, you know, their particular challenge, or be more empathetic to like what they're dealing with. And also resiliency. So I really like that concept of, you know, being able to come back from adversity, or, you know, if there's a negative event that happened, being able to recover from that in a kind of timely fashion. I really like a book from Brene Brown called Rising Strong, and she talks a lot about resiliency and how you can, like, she kind of proposes a process for that. And I find it really intriguing how you can really cultivate resiliency and strengthen that. It's not just like, oh, I'm either born with resiliency or not. You know, you can, it's something you can grow in, like we're always growing. Yeah, I'd say don't let cluttering hold you back, that you can be a great communicator, just educate yourself, learn the techniques that can help you communicate more clearly, and just go out there and do your thing. One of my biggest questions is just how can SLPs reach people who clutter, since, you know, the symptoms are kind of so general that, you know, I feel like it might be hard for somebody to get plugged in to get the right help. So like, how would somebody who clutters like know to, I guess if you have a problem with your speech, you go see a speech pathologist. But, you know, I guess that's my question, is how could, like, if you're reading through like social media posts or something and somebody like what would catch your eye and make you think like, oh, wait, I think that might be me. Let me read more. Or yeah, just kind of like how could we in the profession like raise that awareness to lay people? Yeah, I think some ideas I have are just to share about it more. So, talking about it more, and I share posts and stuff like for my practice. So I'm planning to do like at some point one of my post ideas. I have like all these ideas for like post series that I need to get to, but one of them was going to be like a cluttering post series. So thanks to doing this, I'll probably be doing that very soon. So I'm like, oh, clutter's out. So just kind of talking about it more, and then I know like I kind of chime in on different. There's these Facebook groups for SLPs, and sometimes people ask questions in there. So I guess for myself, I just kind of talk about it more, and share things. Yeah, and then I guess that's a good question, how to get it out there more. Maybe things like, we have International Stuttering Awareness Day, and a lot of people were sharing their stories online or on Facebook just to the public or to all of their friends. Like those kind of things, like sharing their story can just make people more aware of like cluttering being a condition that's out there, and maybe pick up on like, oh, I heard about this thing called cluttering, maybe you could check this out, and help point somebody in the right direction. Sure. So I would say just to educate yourself about all the different types of fluency disorders. So, there's developmental stuttering, there's cluttering, neurogenic stuttering, there's like atypical dysfluencies, like word final repetitions and things that are not usually what are in developmental stuttering. So just really understanding like all those different variations, and then being able to rule out, okay, is this cluttering or is it not? And that even though we may not see many people who clutter over the course of our careers, there's probably stuttering is kind of a smaller subset, and then cluttering is even a smaller subset. So even though you may not see that many, it can really mean the world to like that one person or that handful of people. And so like getting that appropriate diagnosis, and then getting the effective treatment techniques can like really change the course of somebody's life. So even though it's not very maybe too many of your clinical population, still kind of urge you to learn more about cluttering and what it is. And also, yeah, I think just talking about it more, share what you know with other SLPs. If like I have some of those books that I was sharing. So if you read a good book about it, or watch, there's a great video from Stuttering Foundation called Cluttering Another Look. Or if you read too fast for words, tell your friends, hey, I read this great biography, like just share about what you've done, and then keep the conversation going with other SLPs, and it'll just gain more awareness in our professional field, and spill out into the community too. Yeah, it was super helpful because I could really see an in-depth description of the symptoms, like how you described, like, this is how it was when I was a child, this is how it was, as I entered the workforce, this is how it affected me on the job. And like also just seeing like how much it affected you like over the years was like really impactful for me. And seeing like, especially when you're describing, its effect like in the workplace, like, this is a concern, and like, a reason, it just kind of fuels me more to like really want to like truly understand cluttering, whatever like the most effective thing is that's gonna help a client get to the bottom of what's going on and improve. Like I felt like that was really impactful and inspiring for me. So yeah, thank you so much for taking the time to like write the book and share your story, because I know that it's really going to help a lot of SLPs learn more about cluttering, and inspire them, and also let other people who clutter know that they're not alone, and that there's help out there.